I'm Terry Armstrong. I'm president of State Collection Service. Yeah, we're in the healthcare receivables business. We serve over 210 hospitals and about 90 physician groups throughout the United States. We have 4 call centers, located 3 in Wisconsin and 1 in Chicago, Illinois. And we have about 450 people. And then we started out as a bad debt agency, and we've migrated to an early out provider, self-pay, and also some insurance work that we're getting into. The critical thing that's happening today is for our customers is how do you enhance the patient experience and still lower your costs in providing that great service. And something that we face ourselves is that we have to do more work with less people, and that's a challenge for all of us.
My name is Tim Haig, Director of Client Services at State Collection Service. Our clients, obviously, recoveries are a key point, but today patient satisfaction is much more important than it was, say, 5, 10, 15, 20 years ago. The marketplace and healthcare industry being so competitive today, people have choices. And if they have a bad experience, they're going to move on and go on to another healthcare facility that provides the same service. So our job is for our clients to provide the best recovery service, but also to provide the best patient experience.
But we have to be able to contact the right patient at the right time with the right resource. And I think if you look at what Connance has done with their EVI scoring and their segmentation, it's allowing us to do that. The main benefit that we see from Connance over a lot of other scoring programs is that it's healthcare based with the tens of millions of accounts that they have. But working in conjunction with Connance, I think we've come up with a great program so that we're working the accounts properly. So there's no reason to work an account if they're already eligible for charity. And I think you're going to see much more of that coming up with now that 501R has truly been finalized. Our providers are really concerned about making sure that they meet all of those requirements. Certainly, Connance's PARO scoring and presumptive charity has helped that significantly.
The other part that Connance offers is their agency manager platform, which allows multiple agencies to be used at one healthcare facility, and it makes it a much more streamlined process for the healthcare provider. We also like it too because we get apples to apples reporting back, and we can see and do know exactly where we stand with our competition. I think the difference with the Connance score is beyond just providing a number onto a patient's name or their account. They also provide the best workflow for that particular patient. The results have been, outstanding for us. Otherwise, we wouldn't still be using it today. Most examples will see a double-digit lift. We've seen lifts of 10 to 20%, as high as 30% on a particular score band within the inventory. I would by far recommend them, and I have recommended them to other agencies that we know. Again, as I've mentioned, we've seen a tremendous increase in our collections, and they have a superior product. So by far, yes, I would recommend them.
But bottom line is that we have to deliver superior quality, to our clients. We do that by bringing the right tools, and I think Connance helps us with that because business analytics to us today is extremely important. When we bring it all together, I think we can convince the client that we're staying on top of this industry using analytics, and Connance is a great partner for doing that.